Okay, so diastasis recti or separation of abdominals during and after pregnancy. It's an extremely common topic in media. It's been talked about a lot. There's a lot of stories behind diastasis. Don't do this, don't go there, don't exercise this way. And we're going to try to really understand what diastasis is and how it functions. So then you don't have to depend on list of exercises like don't do all of these and do all of these. It's more complicated, it's more nuanced than that. So I'm going to try to explain from the beginning what is diastasis first. Okay, so during pregnancy, let's look at this picture here. This is your abdomen or belly without pregnancy, before pregnancy. This is during pregnancy. So you can see these are two muscles, well, one muscle, one belly on each side. And this muscle is the six-pack muscle. Usually you can see it on your abdomen when you do a crunch at least. And this is called rectus abdominis. There are two sides of these muscles, right? So right side, left side. And in between two sides, there's thin tissue or connective tissue. So think of connective tissue as like a thick layer of leather. What happens during pregnancy, the belly has to expand. You have to make space for this baby, right? So under the effect of hormones, slowly this connective tissue starts to stretch out. Now, as the connective tissue stretches out, the two sides of the belly, muscle belly, separate. So the muscle didn't tear, okay? No tear happened, nothing traumatic happened, just that the tissue in between stretched out. So now there is a gap between the two sides. It can look like this during pregnancy, like it's along the where your belly button is. It can be below the belly button. It can definitely be above the belly button. This is very common by the rib cage. And then it can also be throughout the abdomen, more distributed. This is what pregnancy looks like. In pregnancy, you don't see it a whole lot, even though it does start in pregnancy. Why you don't see it is because this separation occurs and there's more space and the baby takes up that space, right? So the tissue still looks pretty tense and tight, and the abdomen just looks bigger overall. It doesn't look like there is a separation or specific weakness in the tissue anywhere. What happens after pregnancy is when you deliver the baby, now sometimes this gap starts to show up. So this is a postpartum appearance sometimes. You can see there is a gap between two sides of her muscle belly, and the gap in between has sort of like a dip, right? So there's a divot in the middle of her belly here. Sometimes you will see that divot, like a dip. Sometimes in some women or in yourself, you might see a bulge. So if you do a sit-up or if you lift your baby or if you just look at your belly, it looks like there's this gap and there's around the belly button, there is this little bump. Sometimes it's not a small bump, sometimes it's like a big tent. Again, different appearances, same exact concept. It happens in pregnancy 100% of time. You are not abnormal, you didn't do anything wrong if it happens during pregnancy. Research has proven that by the end of gestation, 36, 38 weeks, everyone has it, okay? You can't keep a baby in your abdomen without letting some of that stretch happen. So having it during pregnancy isn't a big problem, which is often what women think, that they're getting a diastasis, they should stop doing exercises or they should start doing something else. What becomes a problem is, one, if it's really big during pregnancy. So if it's this much gap versus if it's this much gap, right? If the gap is this big in the abdomen, you can see it, then that sometimes becomes a problem. Or if the gap does not go away. So after giving birth, when you start to go back to your normal life, you do exercises, you pick up your baby, you do all the things, and then sometimes either the gap gets worse or it just does not get better, and then you start to see this bulge or a dip in your belly. That's often a cosmetic problem for women. In our perspective, sometimes it's a functional problem. The core, the muscles of your abdomen and lower back may not function. There's no evidence that it necessarily causes pain, but it can affect how quickly or strongly your abdomen muscles are going to function. Okay, so not abnormal, but sometimes can become a problem. It can look any of these appearances. It can also change appearance, like it was more in the middle during pregnancy and then a little bit later, or it was throughout the abdomen during pregnancy and then after pregnancy, the top one is gone, the bottom one is still not. So that's often the case. I'm sorry, the bottom one is gone, the top one is not. Okay, so again, six-pack muscle is not the only muscle in the abdomen. There are so many other muscles in the abdomen. There are obliques. Most people know about them. Internal oblique, external oblique. These are angled muscles on both sides. If you remove these muscles, there's also a big muscle called transverse, or TA. And I'll talk about this muscle a little bit later more. So there are different layers of abdomen. All muscles are going to stretch. Okay, so it's not that just six-pack muscle is doing the separation and the whole abdomen is, a whole other trunk is fine. Everything is going to stretch, but this becomes a little bit more visible because it happens in the middle, and sometimes it gives the tissue a weak point to protrude through. So it looks like a bulge or a dip. It's pain-free. This is not a tear. Okay, so this is not like you tear your quadriceps or you tear your biceps. This is just stretching. So usually is pain-free. If it's painful during pregnancy or after pregnancy, it could be something else. It could be a hernia. So if it's painful, you should get checked out, especially after giving birth. All right, so for most people, when we talk about diastasis, everyone is thinking about this gap, like how far are the two sides of my six-pack muscles, right? Is it 1 finger apart, 2 finger, 3 centimeters? How far apart am I? There are two things that you have to pay attention to when we talk about diastasis. One, the gap. What's the gap between the two sides? And two, the tension. What I'm calling tension is how tense is the belly in that gap. So let's see this picture again. If she had this gap that we're showing, but there was no divot, there was no dip in the middle, like it was flat. If it was flat, would she know? Would she care that she has a gap? Probably not. I see women with some gap 6 years, 7 years after pregnancy. Fine, there's a gap if I look for it, but it's flat. Okay, so the tension is there, the function is happening. I don't care, she doesn't care, she doesn't even know. So tension is when that gap in the middle either protrudes or sinks. So something there does not hold the tension well. Okay, so think of tension as if you were to blow up a balloon, the balloon would get tight, right? Now, if you take some air out of the balloon, now it's kind of squishy. So the squishy balloon, when you try to push it, it's gonna protrude, it's gonna create a bulge on the side, right? And that's what's happening. So it's a squishy balloon inside instead of being a tight and filled up balloon. And I'm gonna show you here, this is me. I was 26 weeks pregnant at the time. So a few weeks ago, and you can see I'm starting to get a diastasis. So I was checking my diastasis all along. I had a little bit of gap starting from 18 weeks, and this is 26 weeks. So I had a gap for a good 2 months. There was no bulge. I was exercising, I was fine. I didn't see any bulge. I was checking for it. And around 26, 28 weeks, I started to get a little bit of bulge. So see the difference. So I'm doing a sit-up here. Okay, so between the two arrows are my muscles. Okay, that's the gap. That gap was there for 6 weeks. And now you see a little bit of a tent, right, in the middle. That's the bulge. So I had the gap for 2 months, and then I started to lose tension, and now I have a bulge. Okay, so tension is a different thing, gap is a different thing. You have to help both. And that's why we're talking about this, so that it's not always about gap. It's actually more about tension. All right. So tension is measured, tension is seen basically. You see a bulge, you see a tent, you see a dip in the belly somewhere. Gap is measured with fingers or with something that you put in your hands in the abdomen. You feel two sides of the muscle and you say, okay, they're this far apart, and that's the difference, that's the gap. You can have gap and not have a bulge, but if you have a bulge, you will have a gap, right? Because there's nothing to bulge through if there's no gap. So what creates this tension? What creates this flattening, right? I said I could do the exercises for 2 months. I had the gap, but I didn't have, and I had the gap, I didn't have any bulge. So what creates this tension? The deep core muscles. If you have been in past seminars, webinars, I've talked about this extensively. So I'm going to review this a little bit here, but you should go back and listen to the last webinar. We presented the deep core properly. Deep core are 4 muscles. One muscle is under your rib cage, okay? So right under your chest is your breathing muscle, diaphragm. The bottom inside the pelvis is your pelvic floor. And then the front, wrapping around your trunk, is your transverse abdominis. It's a deep muscle. It's an abdominal muscle. That's all you need to know. We call it TA. And then there's a muscle in the back. Now, what all these muscles do is, if I gave you an example of a balloon, there's a balloon inside your trunk, inside your midsection, and these muscles are basically keeping that balloon tight, right? Now, when you were pregnant, the whole tissue stretched out, all the muscles stretched out, and then all that space was taken up by the baby. So the balloon is filled up. Baby is gone, and within 24 hours, now you have no baby inside and no tension. So now this balloon is really floppy or really squishy. And that squishy balloon basically gives you difficulty holding that tension. These muscles can help you create that tension, and that's why we engage these muscles. Let's look at this picture here. Okay, so the top is the diaphragm, the bottom is the pelvic floor. You see the arrows coming from the side, that's the abdomen, the abdominal muscle, the TA muscle. When this muscle contracts, it can create some of that tension or some of that extra pressure that you have lost. And that's why creating this extra tension is going to hopefully flatten that little bulge you had between the gap. And how do we engage this muscle? This is the muscle. So transverse abdominis, it's the deepest layer of your abdomen. If you were to remove all the layers, you remove your six-pack, you remove your obliques on both sides, you removed all the muscle, the most innermost muscle will be like this. It looks like a corset around your trunk, basically, okay? And it functions like a corset around your trunk. If I was to put a belly band around your trunk and pull it, wouldn't it basically pull everything together, create that tension? And that's what this muscle basically does, okay? It helps create the pressure and tension in the separated connective tissue in the middle. It doesn't close the gap, okay? I'll tell you what closes the gap a little bit later, but it does flatten the gap. And that, to me and to most women, is more important thing, because you want your belly flat. You don't care if there's the gap. You don't even know if there's a gap, right? So this is how the deep core functions. Those 4 muscles I showed you earlier, this is the diaphragm, the breathing one, the pelvic floor, the Kegel one. These lines show the transverse abdominis, and you can see when the diaphragm goes down, the belly expands. The diaphragm goes down, the belly kind of comes out. When the diaphragm goes back up, the belly comes in. When the pelvic floor goes down, the belly expands. And you can see every time the pelvic floor comes up, the belly comes in. So there is an inherent connection of your pelvic floor and your abdominals. You cannot have a very weak pelvic floor and hope to have very strong abs. That's difficult, okay? Because these muscles are neurologically connected. They work together. When somebody does a really good Kegel, they automatically engage their deep abdominals. When they do very good abdominal contraction, they automatically engage their Kegel, their pelvic floor. So that connection is very important. That's why I'm bringing all these three muscles into picture. Whenever I'm going to talk about any one of these muscles, I'm going to talk about all three of them because they really do work together. Okay, so what we want is we want to really engage that corset-like muscle. And when that corset-like muscle engages, it goes in, it pulls in. What that happens with is when you breathe out and you do a Kegel. So breathing out, pulling your pelvic floor up and engaging this muscle, all three of those things happen together. Okay, and I'm going to show you a few times how to engage all three of those things together. You should try to engage. I know there's 3 cues to follow. It's probably too much to follow, but doing all three things will help you do each one of those things better. So breathing out, engaging abs or engaging TA, and Kegel. How do we do that? Right. So we call it activating the canister because, like I said, there was a canister inside the trunk, top, bottom, front, and we're activating it, meaning we go like this. So every time this goes up, we're active, we're tightening, we're creating pressure. Every time this goes down, we're relaxing. So we're creating this, we're activating this canister, which is going to create that pressure or tension, which is hopefully going to flatten some of that diastasis bulge. Okay, so flat on your back with your knees bent, both hands on the pelvic bones. So if your hands are on the side of your belly, you're going to end up on 2 bones on each side, one bone on each side. Keep your hands there and then gently just fall off those bones on the inside, very little bit, okay? And you're going to keep your hands there. You're going to breathe into your belly, not in your chest, in your belly. So it's not a breath like, no. You're going to breathe gently, but prolonged. Think about getting the breath into your belly. So you're going to breathe slowly into your belly, and I'll show you in a picture here. Then as you breathe out, those 3 things are going to happen. As you breathe out, you're going to think about pulling these 2 fingers together. They're not actually going to move. Okay, that's just an imaginary cue. You're thinking of pulling these 2 bones together. Okay, and at the same time, you're going to think about pulling your tampon in. Okay, so imagine you have a tampon inside the vagina and you're trying to pull that up and inside. Okay? Or you can think about closing the vaginal opening and pulling that vaginal opening inside the body. Pull is important. Don't squeeze or don't just squeeze. Pulling up towards your belly button. Okay. So breathing in, belly gets bigger. Breathing out from the mouth, think of pulling those sides together, and I'm thinking of pulling a tampon. And my hands are showing the direction that you're thinking of moving in. The hands don't actually move because of the muscle. There is no movement. You feel your belly flattens a little bit, okay? Your belly flattens because you're exhaling and you're doing a Kegel. You don't think of flattening your belly. You don't think of gripping or sucking your stomach in. You think of pulling the sides together. As a result of that, the belly comes in automatically. There's a big difference between the 2. Okay, standing position. Same thing, breathe in, breathe out, hands come together, or think of pulling the hands together, and I think of pulling my tampon in. So breathing out, tampon in, pulling the sides together. And all of those things are gentle. Okay, it's a gentle breathing out, like it's a gentle pull from the pelvic floor, and it's definitely a gentle pull with the hands. This is not like, oh, I'm gonna exercise. This is just activating the core. Exercise will come later. So what happens when you engage that deep core. So this is my picture again. I did this the same day. So between the last video and this video, the time was probably 5 minutes, okay? So obviously I still have the same gap. I still have the same tension. But what I did was I tried to activate my deep core, all the things I just showed you, to see if I can create more tension. And here's what happened. Breathing in, and I did a sit up, and you can see the gap. Okay. Again, sit up and a gap. And then before I did a sit up, I did an exhale and a Kegel, the same thing I've been teaching you. Okay. And then I did a sit up, and you can see there is no bulge. Okay. Obviously my gap is still there. So now I can do all the exercises I want to do. I don't like to do sit-ups, so I didn't, but I was just checking. If I see that gap or that bulge coming in when I squat, I try to engage my deep core. I try to create that tension and see if I can keep that bulge from coming. If I cannot keep that bulge from coming, which will happen eventually, pregnancy, the gap is getting bigger, the tension is decreasing, then I won't do that exercise. But I'll try to modify my routine so much that I can still do most of my exercises. Maybe I can't lift 50 pounds that I want to lift, but I can lift 35 without seeing that bulge. Okay, so just because a gap is there, exercises are not going to make it worse. But if a bulge is there, I don't want to feed into that bulge because that's the bigger problem. So I'm going to try first to create tension by engaging my deep core and see if I can do the same exercises and not modify. But if engaging the deep core and I still see the bulge, which happens now, if I do a sit-up, no matter what I do, I'll see that bulge. So I don't do the sit-ups. Okay. And this is during pregnancy. So all the women who have diastasis and are very worried, should we exercise? Should we exercise? You should exercise if you're not seeing the bulge. Well, you should exercise one if you know how to engage, how to connect with that core, deep core, the 3 things that we talked about. It's not a lot. It's just you have to keep practicing it again and again. And you can really see the difference between the tension that is created. And 2, 1, you can engage the core. 2, you don't see a bulge. Okay, so I see bulge mostly when I do a sit-up or if I do a crunch with an oblique together. I can do a squat, I can do lunges, I can do deadlifts, and I don't see a bulge yet at all, especially if I engage my deep core. That could be different for you. Okay, that could be different for you if you're much later in the pregnancy. It could be different for you if this is your 2nd or 3rd child. So everyone is different. You are not going to try to not exercise. That's wrong. If you stop exercising, you're going to lose the little bit of tension, a little bit of strength you have left in these muscles. So don't stop exercising. You also don't have to stop exercising your abdominals. You can still exercise your abdominals. You just have to be smart with creating tension and not doing the things, specifically not doing the things that are creating a bulge. And that shouldn't be many things. You should be able to do 90% of workouts without having to do the exercise that causes the bulge. So what about the gap, right? So we said this was the gap, and then there was a bulge in between, and there was a dip in between, and the bulge and dip was because of the tension. And if we engage the deep core, we can fix this tension, hopefully. But what happens to the gap? Gap is still there, right? After, gap is going to be there in pregnancy. There's no way to stop it, right? You have to grow a baby in there. But after pregnancy, this gap decreases. How does this decrease? Does something pull it together? Is there a muscle that pulls this gap together? Can we put a binder on? Can we put a tape on? What can we do that will pull these sides together? Okay, so we don't actually pull these sides together. What happens is, over a period of time, slowly the connective tissue between the 2 sides starts to shrink. Everything starts to go back to the previous stage. So it starts to shrink, and body also starts to form new connective tissue. Okay, so new connective tissue is being formed. The old tissue is kind of coming back, like your skin goes back after you give birth, right? And then the vaginal opening goes back, the uteral, all the things go back. So slowly this tissue starts to go back, and that's what eventually closes the gap. You are not pulling the gap together. You don't really have a lot of control over the gap. The only control you have over the gap is that you have to give your body a cue that we need a connective tissue here. What I mean to say is you have to exercise. So you know how your heel, if the backside of your hand, of your foot, your heel has a thicker skin, right, than your hand. Your hand has a soft skin, but your heel has a thicker skin. Why? Because every time you're walking, you're putting that heel down. Your body knows that this tissue here is going to take some weight again and again. So body starts to form more connective tissue there. The skin there becomes thicker. If you exercise, you keep exercising, your body gets a cue that we need to make more tissue here, that there's continuous, there's strain or work coming through this line, and we need strength here. So it will form tissue. If you just rest and get scared or not do anything, there's no reason for your body to form that tissue there. Okay, so only little bit of control that you have over this connective tissue formation is by exercises. Some people don't, and it just goes back because it somehow we think that it depends on genetics too, that some people will just have a different kind of connective tissue that forms quickly. Okay, and it can take months. The reason that you see that your diastasis gets better quickly after you exercise for 3 or 4 weeks is not because the gap is gone. It's mostly because the tension is forming now. So you don't see it, okay, unless you look for it. But actual closing of the gap, actual formation of the connective tissue, that can take months, okay? Research is a little bit contradictory on this. Some say 18 months, some say 24, some say 12, but it can definitely take months. So the better way to do it is learn how to control the tension, keep exercising, get stronger, get back to your routine of exercise. If you don't have a routine, build one, and then slowly we're going to keep checking to see if the gap is closing. You can definitely be strong and have a gap. That's not important. Just because you have a gap doesn't mean that your core is weak. If you have a bulge, it may mean that your core is not functioning as well. But just having a gap does not mean that you're not strong. The second is having a protruding belly. I see some women, they don't have like a small gap around or even a big gap around their belly button. What they have is that their entire abdomen in the front, their entire belly just rounds out in the front. So this bulge in the abdomen that comes in the front may not be the diastasis. Maybe that the whole trunk got stretched, right? Everything got stretched. The skin got stretched, all the muscles, all the tissue got stretched. So even if there is no separation, even if there is no bulge, there's possibility that the whole abdomen is just loose. So if the whole abdomen is loose and you don't see any gap, you don't feel any gap, but the whole thing looks protruding, it could be that there's just no tension in the entire abdomen. So you need to strengthen and build tension in the entire abdomen. In that case, it's not about diastasis at all. So just because you have a big protruding belly in the front does not always mean that you have a diastasis. And that's also a big misconception with most new moms. Okay, so how do we close gap? So we create a tension, and now we're going to keep that tension and do exercises. That's how you help your body close the gap. Creating the tension is how you flatten the gap. And then taking that and creating and doing exercises is how you close the gap slowly or at least help your body close the gap slowly. So these exercises are necessary. But that deep core engagement first is the thing. So every exercise that I'm doing here or showing here, I'm engaging, I'm doing all those three things, is breathing out, pulling the sides together, and doing a Kegel at the same time. All right. So these are very simple exercises. I included them here because they're usually safe for you from day one of you giving birth, because this is a postpartum course, pregnancy and postpartum course. So we're talking about pregnant women. Pregnant women definitely can do this. Pregnant women can usually do more than this, but postpartum, when the tension is suddenly gone, is a hard time. That's when the trunk just feels very off and loose and weak. That's the time that these exercises you should do. So if you're pregnant, which I'm assuming most of the participants are, then these are the exercises you're going to start doing now, so that you remember to do them just from the day one, right? Right after you give birth. I'm going to breathe in to my belly as the belly gets bigger. I'm going to breathe out from my mouth. Think about pulling the sides together. As I engage those sides together, then I'm going to lift one leg, and then I'm going to lift the other leg. What my hands are feeling for is those two bones under my hand, right? These bones should not move a whole lot. Okay, so it shouldn't be that as this leg goes up, this hand falls down. That's what you would feel if you were not engaging your deep core. So without engaging the deep core, you feel like this leg goes up and this side of the pelvis falls back. What you do after you engage is that the abdomen is a little bit stiffer now, so that the bones don't move a whole lot when the legs lift. Okay, this is the easiest one, and then we're going to see more progressions. The idea stays the same. Minimize the motion of the pelvic bones. They're going to move a little bit, and that's okay. You're not trying to flatten your back. You're not trying to grip your stomach. You're trying to again and again do those three things and engage your belly, keep it there, and see if you can move your legs without letting the pelvic bones move. So breathe in, breathe out and engage, sides together, tampon in, hold that. Don't let these bones move, and lift the leg up one at a time. This will be too easy right now, but it will not be so easy on day 1 or 2 after you give birth. 2, same exact thing, starts the same way, breathing in, breathe out, sides together. This time I bring the leg straight and pull the leg back in. Okay, when I bring the leg straight, the tendency is that that side of pelvis will drop down. So my job is to keep that abdominal engaged and keep my pelvic floor engaged, so I keep it from dropping down. And if it drops down a little bit, that's okay. Your intention is to keep it from moving too much. Progression 3. Starts the same way. Engaging the sides together, pulling the tampon in, and then I let my leg drop. As the leg drops, the tendency is the side of that side of pelvic bone to just follow, drop down with the leg. So if I engage my abs, I'm hoping that I can keep this pelvic bone stable and only move the leg. Okay, and this is the 4th. Then we start to get into harder positions. This is hands and knees. I'm going to engage the exact same way. It's going to look a little bit different, but I'm breathing out, pulling the sides together, tampon in, and then I'm going to lift my leg behind me. Okay, and hoping or trying to keep my pelvis neutral. Here I can't feel the bones, so my intention will be, imagine there's a cup of coffee on your back and you don't want that cup of coffee to fall. Right? So I'm going to try to keep my pelvis as stable as I possibly can. And you don't have to be perfect, but you have to try. And these are very safe exercises. Even if your pelvis moves a little bit, it's not going to hurt anything. But these exercises are really training your system at a deeper level than just doing other exercises, abdominal exercises. So can you do crunches? Can you do squats? Yes, all of that will come. We're talking about day 2, day 3, first week after giving birth. That's the time you reconnect with your core, you reconnect with your pelvic floor, you start to really reconnect with all that tension creating muscles. And once you have them connected, and you can, if I say engage your TA, you shouldn't have to think about it, okay? Your breath should go out automatically and it should engage. All those things, the pelvic floor, the abs should come in quickly. So I want you to practice it so many times during pregnancy and after giving birth that engaging this deep core is just the easiest thing for you to do, okay? It becomes a second nature. When it becomes second nature, a whole lot of other exercises and all the options will open up. What about bands and brace? I get asked often, should I wear a brace? Should I wear a brace during pregnancy? Should I wear a brace during postpartum? Typically, you really don't need to wear a brace during pregnancy, okay? If you feel like, if you really think that there's a huge huge basketball in your belly, like your belly is really big out in the front, or you're carrying twins and you're really worried about diastasis, then go see a physical therapist and we can measure your diastasis. And if it's really big and we're concerned, we'll tell you what to do, okay? Wearing a compressive brace during pregnancy is, by default, is never advised. You have to give your baby space to grow, okay? After pregnancy, I will often say, yes, you can wear a brace if that makes you feel better. Just understand why you're wearing a brace. Most women think that a brace is going to pull their sides together and then we're going to just keep them there and somehow there will be a glue in your body that will glue these sides together because you've kept them together with the brace. That's not what happens, okay? So you're not going to glue anything together. What you are doing when you put a brace on and you feel better, you can do exercises better, you can lift your baby better, your pain is less, is that you're creating that tension. Remember I said all this, the muscle that was creating the tension pretty much looked like a brace. So you're not, instead of using your own natural brace, now you're using an external brace and creating that tension. And when tension is there, suddenly your muscles can work better. Your deep core can work better. So can you use a brace? Yes, you can. Should you always use a brace? No, no. Use a brace if you feel better with it. Use a brace if you have a lot of pain and that helps you with the pain. But more often than not, use a brace if you can exercise better with it. So all the exercise I showed you, right? And you were trying to do them, and no matter what you did, as soon as you lift your leg, there's the bulge. Or as soon as you pick up your baby, there's the bulge. If you keep seeing your bulge and you're trying to engage your deep core and the bulge does not go away, that's the time you use the brace, right? That means your natural system isn't able to create tension no matter what you do. Then you start to wear the brace, give it extra tension from the outside and help your muscles build up from inside. Then 2 weeks later, take the brace off, do the same things, see if the bulge is less or hopefully gone, right? So this is a temporary measure to help you build that tension until you get to a point where your muscles can do that work with themselves. In long term, wearing this brace in long term is going to hurt you because the longer you wear a crutch, your body may think that you don't need your muscles anymore. So your body gets into a pattern of not building those muscles anymore because you always have this help, right? So I will usually in my clinic prescribe a brace if there's severe pain, and that's if every time you're bending over, there's a lot of pain, there's a bulge, and with the brace, the pain and the bulge is gone. Okay, you wear the brace for 2 weeks, tell me what happened. or I will give the brace when I think that she's not even able to do the basic things. Like she's not able to bend over and pick up her baby without feeling that bulge, without seeing that bulge. She has to pick up her baby. So I'll say, okay, let's give you a brace. And then I will, every 2 weeks, I will try to take the brace off. So every 2 weeks, take the brace off, go about your way, see how you feel. Is your pain really that bad? Do you need the brace still? Do you see a bulge a lot? Do you feel weak? Sometimes you can wear a brace only for the workout, because if you only need the extra tension when you're doing a squat, but you don't need an extra tension squat with, let's say, 40 pounds, but you don't need that extra tension if you're just bending over to pick up your 8-pound baby, then it's okay. You don't need the brace. So you can see the bulge. That's a good thing. And understand that it's giving you tension. It's not closing the gap. And closing the gap is more than just the brace. So that's one point, when to wear a brace. Second, how tight is that brace? That is a bigger problem. That's a big problem. A lot of women have that brace, or what they're calling these days is a waist trainer, which there are hooks in the back, it gets tighter every week, or there's sometimes straps in the back and you're pulling those straps tight. That's just not good. And I'll explain to you why it's not good. So imagine this balloon. We talked about the balloon a little while ago. Now this is the balloon, the blue balloon in the picture here. If I take my hands and I squeeze a balloon from the middle, what will happen? The air will go up and the air will go down, right? So pressure will go up and pressure will go down. What is up? Up is your diaphragm. Remember that muscle on the top? And down is pelvic floor. So you're pushing the diaphragm up, you're pushing the pelvic floor down. What does that mean? The diaphragm cannot come down anymore, so you can't breathe in your belly. You're always breathing up in your chest, and you're pushing the pelvic floor down, so now you can't really effectively do a Kegel. So all that deep core that was functioning up and down beautifully, you have stopped it. Does that sound like a good idea? So a tight brace really does hurt the system. So don't wear a very tight brace. What is too tight? It's too tight if you can't breathe in your belly. It's too tight if you feel like your Kegels got weaker when you put the brace on. So do a Kegel, sit down, do a Kegel, stand up, do a Kegel, walk around, do a Kegel, see how that feels. Then put the brace on, however tight you want. Sit down, do a Kegel, stand up, do a Kegel, do the same things. And if you feel like your Kegel got weaker, that brace is too tight. Your Kegel, if anything, should get stronger. Like the balloon was too loose. If we bring it together just the right amount, it will work. If you bring it too tight, then it will push up and down. Okay? So too tight is the bigger problem rather than having it or not having it. So finally, the myths. Diastasis is not abnormal. Diastasis is very normal during pregnancy. Braces, especially during pregnancy, will not prevent diastasis. Abdominal exercises do not make it worse. Okay, a squat can make it worse, walking can make it worse. If you're not engaging, anything can make it worse. We don't know that. But usually, exercises are not making it worse if you can keep and create that tension. Running and jumping will not make it worse. Again, we have to heal diastasis. This is often written in so many social media. We have to heal your diastasis. I don't know what we're healing. There's nothing to heal. There's nothing torn. It's not painful, right? So it's not like if I stretched my finger or if I tore my quadriceps and I'll let it heal, because, well, there's inflammation there, there's injury there. There's no inflammation here, there's no injury here. Sticking to safe exercise is always good. Never do crunches, never do heavy lifting. And I asked this on my Instagram yesterday, should you do crunches? Well, if I do crunches and I can create the tension and keep it flat, I have no problems doing crunches. I should do crunches. But I may not be able to do much easier exercise like a bridge if I cannot keep the tension. So exercises are not always good or always bad. C-section does not prevent diastasis. And surgery is needed. Surgery is rarely needed when it's a big gap, usually not done until 2 years after giving birth. So we give your tissue best chance to really heal, not heal, to get stronger. Diastasis rehab is extremely individualized. There are no rules. Whenever you see an online program and they say, never do this, or always do this, that program is wrong, okay? There are no rules for everyone. At the very least, we should teach you, okay, don't do this, if this happens. Don't do this, if this happens, right? If you cannot create a tension, if you see a bulge, if you're leaking, if you're pushing down into your pelvic floor, if you cannot breathe properly, there's so many ifs that depend if you are going to do an exercise. There's nothing bad for exercise, diastasis. I have done all of these exercises that you see on the screen with my patients, and they have improved their diastasis after doing them. But they did not start with a point of bulge. They could control that. We built up to that place where they can do that exercise. A woman who wants to lift 200 pounds, if I keep her on her back and have her do little leg lifts, she's never going to be able to lift 200 pounds. So I started her when she was lifting 60 pounds and she was bulging. We backed up a little bit. We started doing the connecting with the core. She was able to control it and go to 120 pounds right away. And from 120 pounds, we had to do different things. Sometimes we had to put a brace on. Sometimes we had to do Kegels. Sometimes I had to work on her alignment. But eventually, if her goal is to lift 200 pounds, we have to work towards lifting 200 pounds. And she was able to lift 200 pounds without any diastasis, okay? So you cannot not do the exercises. You just have to find which way to do exercises, how to progress to that point, and definitely be able to see or feel what is happening in your abdomen. Is it bulging? Is it tenting? Is it dipping? Are you bearing down into your pelvic floor? What should be avoided? Obviously bulging, doming, tenting. But if you feel like you're bearing down into your pelvic floor, like the vaginal opening is getting some pressure, there's some heaviness there, that means you're pulling in so much that your pelvic floor isn't able to keep up. So you have to back up a little bit. If the exercise is too easy, there is not enough system in your feedback in your system to change things, to trigger some connective tissue formation. And if exercise is too hard, then you might see bulging and doming, and that's not good. And that's why physical therapy. In physical therapy, I really do believe one-on-one care for diastasis is very important, at least in the beginning for some time, because when I was able to control my diastasis, I was breathing out and doing a Kegel, okay? Somebody else might just do a Kegel and be okay. Somebody else might do a Kegel and breathe out and still might not be okay. And I will have her lift up a little bit, or I will have her change position or change breathing. There's so many ways that you can be at a certain point. So there are no rules. You do need assessment, okay? The idea of this presentation was for you to, again, reinforce that deep core, reinforce that exercises are not bad, tell you that diastasis is normal during pregnancy, and tell you that as soon as you get out of pregnancy, as soon as you deliver, that first 1-2 weeks, doesn't matter if you have a diastasis or not, you likely have, start to connect with those muscles, start to engage those muscles, and that will do you a lot of good, whether the diastasis heals by itself or you need some help. It will help you get there quicker. References from the earlier slides. And thank you.
All right. If you have any question right now, can you put it in the chat and then we'll take it and we'll ask Nidhi. And let me start the question we had submitted before.
So Nidhi, you said that the tension is going to be important for diastasis recti. Can you do anything to prevent having severe cases of abdominal separation? If there is, like, what type of exercises should people start doing, maybe like pre-pregnancy or during?
So engaging with the core muscles, you know, the same canister we've been talking about, those muscles right from the beginning of the pregnancy is important. And as can you do anything before pregnancy to avoid it? I don't think so. Like, you know, just be active and strong. um, there's no evidence that people who are obese have more diastasis, but some people say that that can predispose you because there'll be more pressure on the abdomen. There's no evidence for that though. So I would say, you know, healthy amount of weight gain and healthy amount of strength in your legs and your abdomen will be good. But as you start to get into last end of first trimester and entering the second trimester, that's the time to really start to connect repetitively with these core muscles, because that's when the separation usually comes, even if there is no bulge. So what kind of exercises? Basically any workout is fine. Whatever you like to do. You like to do yoga, you like to do Pilates, you like to do swimming, you like to do skipping, whatever you like to do. I would still do some amount of strength training, which is advised in pregnancy anyways. Squats, some lunges, like some leg work that we advise anyways, because your weight is going to increase. So all those exercises, when you're doing them, the leg exercises, the workouts, just start to engage your deep core muscles with them.
So the next question is, this person is 4 years postpartum, and she was told after delivering a baby not to do any abdominal workouts, and it's been 4 years. And I think a lot of, in different countries, they still maybe tell patients or, you know, new moms not to do like vigorous or like sit-ups, like crunches type of abdominal works to strengthen their core. But I'm not sure if this person had diastasis recti to begin with, but she was told, and she hasn't been doing those exercises. And like I said, I don't know if she had she can be like doing those exercises at this point, but what is the first step she can take now?
Well, the first step, if she was told specifically not to do things, there's a possibility that she has diastasis. Like the doctor saw something and they said that, although sometimes they just say it regularly. It'll be good to get checked out to see, do you have diastasis? Do you have some sort of bulge that means you can't be doing these things? But also, if she has not done any exercises in 4 years, any abdominal exercises, going back to exercises and starting with sit-ups is probably not the best idea. Like, that's an intense thing. So why not build slowly? So connecting with, even if you don't have any diastasis, if you have been scared of a certain movement or been told not to do a certain movement for 4 years, it'll be good to ease into it. So I would say practice all the things that we talked about here. And then if none of those things hurt, and obviously get to a PT and there is no diastasis, then slowly build up. Slowly build up into a workout with the legs, with arms, with keeping the spine neutral, and then going into flexion or extension, like bending or straight extending, like ease into it. That's a vague answer, but I don't know her situation exactly, so
right. So she should go see someone that can check out. Yeah. All right, so the next question is, so you showed us several exercises to help with the separation in the video, in the presentation. Can they also work for people after abdominal surgeries or abdominal incisions?
Yes. So yes, they will. And typically they will be the same exercises if there's a diastasis repair or even a hernia repair. You just have to follow up with the surgeon to make sure they're okay with it, like follow the protocol.
That is it from me.
Any questions?
I don't see any questions.
Okay.
Do you?
I have a question. So when to use SI joint belt versus brace? Is there, any guideline like what to use and then when to use?
So we're using brace mostly for the loss of tension. So I will almost never use the brace for pain because it kind of does the job of the muscle. So I don't want to do that. If there's pain, I would rather find SI joint belt or some other solution. I'll almost only use the brace when I see that she's bending over and there's a bulge, or she's picking up her baby, or she's pushing a stroller and there's a bulge. Like she cannot create that tension no matter what we do. Or that she can create that tension in a like perfect alignment and when she engages, but when she carries her baby for 10 minutes or 15 minutes, she can't. So that's almost exclusive the only time I will give a brace. Does that answer your question?
Yeah.
I very, very, very restrictive with brace. Brace only goes to people who have clear bulging through the diastasis, almost no one else. Everyone else is SI joint belt. If I'm going to use something, it will be SI belt, like for pain or for other things.
All right, thank you very much. All have a good night or day, and we'll see you next week.
See you next week. Bye, Yohei. Bye, Amy. Bye, everyone.
Bye.